Welcome to our channel. Today, we're exploring cervical cancer, a significant health concern for women worldwide. Understanding cervical cancer can help with early detection and prevention. Don't forget to like, share, and subscribe for more health and wellness content. Cervical cancer occurs in the cells of the cervix, the lower part of the uterus that connects to the vagina. It is usually caused by persistent infection with certain types of human papillomavirus, HPV, a common sexually transmitted infection. The primary cause of cervical cancer is infection with high-risk HPV types. However, several risk factors can increase the likelihood of developing cervical cancer. 1. HPV infection, persistent infection with high-risk HPV types. 2. Smoking. Tobacco use can increase the risk of cervical cancer. 3. Weakened immune system. Conditions like HIV/AIDS can make it harder for the body to fight off HPV infections. 4. Multiple sexual partners. Having many sexual partners or becoming sexually active at a young age increases the risk of HPV infection. 5. Long-term use of birth control pills. Extended use of oral contraceptives can slightly increase the risk. Cervical cancer in its early stages may not cause any noticeable symptoms. As the disease progresses, symptoms may include 1. Abnormal vaginal bleeding, bleeding between periods, after intercourse, or after menopause. 2. Unusual vaginal discharge, watery, bloody, or foul-smelling discharge. 3. Pelvic pain, pain during intercourse or in the pelvic region. 4. Painful urination, discomfort or pain while urinating can be a symptom of advanced cervical cancer. Early detection through regular screening is crucial for preventing and treating cervical cancer. Screening methods include 1. Pap test, Pap smear. This test checks for precancerous or cancerous cells on the cervix. It is recommended for women aged 21 to 65 every 3 years. 2. HPV test. This test detects the presence of high-risk HPV types in cervical cells. It can be done alone or in combination with a Pap test for women aged 30 and older. 3. Colposcopy. If abnormal cells are detected, a colposcopy allows the doctor to closely examine the cervix using a magnifying instrument. 4. Biopsy. During a colposcopy, a small sample of cervical tissue may be taken for further examination to confirm the presence of cancerous cells. Prevention of cervical cancer includes 1. HPV vaccination. The HPV vaccine protects against the most common high-risk HPV types that cause cervical cancer. It is recommended for girls and boys starting at age 11 or 12, but can be given as early as age 9 and up to age 26. 2. Regular screening. Regular Pap and HPV tests can detect changes in cervical cells before they turn into cancer. 3. Safe sexual practices. Using condoms and limiting the number of sexual partners can reduce the risk of HPV infection. 4. Quitting smoking. Avoiding tobacco can reduce the risk of cervical and other cancers. The treatment for cervical cancer depends on the stage of the disease, the size of the tumor, and the patient's overall health. Options include 1. Surgery. Early-stage cervical cancer can be treated with surgery to remove the cancerous tissue. This may involve a hysterectomy, removal of the uterus, or a trachelectomy, removal of the cervix while preserving the uterus. 2. Radiation therapy. High-energy rays are used to kill cancer cells or shrink tumors. It is often combined with chemotherapy for advanced stages. 3. Chemotherapy. Anti-cancer drugs are used to kill cancer cells. It can be used alone or in combination with radiation therapy. 4. Targeted therapy. Drugs that target specific aspects of cancer cells can be used for advanced or recurrent cervical cancer. Cervical cancer is a preventable and treatable disease when detected early. Regular screening, HPV vaccination, and healthy lifestyle choices are key to reducing the risk. Understanding the symptoms and seeking timely medical attention can make a significant difference. If you found this video informative, please give it a thumbs up, share it with friends, and subscribe to our channel for more health and wellness content. Thanks for watching, and see you in the next video.